The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
Today I want to share with you 3 exercises to improve lateral knee pain. Now the lateral knee pain I'm referring to is specific to a very common muscle imbalance that involves your IT band on your lateral quad or your outer quadriceps head. Now what happens is that with a lot of sitting or with repetitive activities that don't allow full range of motion of the hip and knee, like cycling, I'm a cyclist so I know we are prone to these sorts of things, the IT band can get glued down to that lateral quad, and where they should be gliding along one another as you're bending and straightening your knee, they get glued together and they start to really pull and create a lot of tension down the outer leg. And that can actually start to pull on the outer knee and draw the kneecap outward away from your midline every time you're straightening your knee. It can create quite a bit of irritation along that outer knee. Now, if all of that is happening, then we also know that the inner quad head, also known as VMO, is probably not working optimally, nor is your outer buttock, which should be stabilizing your pelvis when walking, it's not working optimally as well. So what I want to show you tonight are 3 exercises to get you started getting some motion back in that lateral leg and also activating that inner quad head. To get started, you're going to need something soft to kneel on, and then probably a book or a block that is anywhere from 2 to 3 inches high. So my first exercise for you is kind of a cousin to the half kneeling stretch that I've shown before. So if you're familiar with my half kneeling stretch, you're familiar with the alignment of the front knee over the heel and the back knee under the hip. But for the sake of this lateral leg, we're going to change it a little bit. So I'm going to turn towards you so you can see me a little bit better. And you can see that this is my initial alignment with this back knee under the hip. What I'm going to do to really bring in those outer fibers of the quadriceps is I'm going to lean forward, put my hand on the floor to unweight my knee, and then I'm going to rotate my thigh inward, so toward my midline, so that my lower leg is kicked out to the side. Now, when I come back up, I'm going to feel quite a bit of tension or pulling along that lateral leg, and that's exactly what I'm looking for. Now, depending on how tight your lateral leg is, you may need to back off of that rotation a little bit. So make sure you calibrate this position for whatever's going on in your body. You might not be able to get that leg out as far as I can, and that's okay. Over time, that should improve. Now, next, what you're going to do is make sure that your pelvis is relatively vertical and your torso is upright, and you're going to squeeze that buttock. So in this case, I'm squeezing my left buttock, and that really creates more of a stretch along the front of my thigh as well as the outer thigh, and then I'm going to back out. So I'm just going into and out of that stretch maybe 8 to 10 times and trying to get these tissues to give me a little bit more room. Now, after I've finished going 8 to 10 times on that affected leg, I could also do the other leg, but if it's not really problematic, you can move on to the next exercise. The next exercise, I'm just going to move my pad, involves kneeling. So if you can't kneel sitting on your heels like this, it's okay. You can put your hands in front of you and hold your buttocks right off your heels. Just go as far as you can because this is really good for the knees. Remember, I said you got to get more range of motion at the knees. So you get as much as you comfortably can, no pain. And then I want you to take your hips off to one side. Now, if it's available to you, you can go ahead and fan your legs out a little bit. And that allows a little bit of rotation at the knee. Now be careful here that the biggest part of the rotation is coming from your hips. So this should never hurt your knee, but hopefully it's giving you a little bit more motion where that knee has been very stiff. Now, you only stay there for a moment and then you return through your kneeling and over to the other side. So you can fan your legs out this way. Now, like I said, you're just going to go into and out of these positions, switching positions, which is creating a little bit more motion around those knees. And this should all be healthy, happy motion. Remember, if it's giving you pain or strain, you're going to want to modify this or avoid it altogether. So hopefully, if this is just a muscle imbalance for you, this is feeling pretty good. So you're going to go into and out of that kneeling position about 5 times per side. And then when you're finished, we're ready to start activating that VMO. Now, before I get to that activation exercise, I just want to remind you that if you like this information, if you find it helpful to you, please click like, click all the buttons, subscribe to the channel if you haven't done so yet, and do please share it with your friends and family. We really appreciate your helping us get the information out to those who could really benefit from it. All right, getting into that VMO activation. So this is where you're going to need your block or your book. I mentioned that it needs to be 2 to 3 inches in height. Lower than 2 inches, you're probably not going to feel much. Higher than 3 inches, it could be problematic. It actually could be painful for your knee. So let's keep it between 2 to 3 inches. We're going to put the working leg or the affected leg on the little block or book. We're going to call it a step. And this is what we're going to do. I'm going to go ahead and raise my pant leg so that you can see what's going on here at my knee. And we're targeting this little teardrop shaped area around the medial aspect or inner part of the knee. Now, what I want to help you understand is that when you've got all this tensioning going on down the outer leg, your knee wants to collapse inward. So very, very important here as we set up for this exercise that you use your outer hip to rotate your thigh bone out to the side a little bit. And you can see as I did that, I took my knee just a little bit beyond the middle of my foot. And I find that's really helpful because as you start straightening and bending the knee, it's going to want to drift back in. So you've got to really hold it slightly laterally rotated as you're going through the range of motion. Now, you're going to let this right leg be the helper leg. And what you'll do here is keeping that lateral rotation at the thigh. So we're rotating the thigh that way. You're going to straighten your hip and knee. And you can see that my leg is fully straight at the knee. I'm not hyperextending it. I'm using my muscles. I'm activating that little teardrop shaped muscle there, the VMO, and then I'm going to slowly come back down, again, maintaining that little bit of lateral rotation. My right leg is assisting me so that I don't have to worry about balance, and I'm also not having to carry my entire body weight over this leg while I'm retraining it, because I am retraining it, right? I'm activating a muscle that's been underactivated in the quad as well as in the outer hip. So we're retraining this whole chain. So you'll practice this exercise 8 to 10 times. Again, you should feel that outer buttock and this inner quad head. And after you do that, you should feel like the knee is getting a little bit more motion and feels a little bit more stable. So that's all I have for you this week. Until next time, keep moving and be well.